today on intellectual and developmental disabilities. We've got three great presenters who are experts in their field. We've got Kirsten Oster, Ann Anand, and Beth McHugh. One from, they'll introduce themselves and say which county they're from, but we've got one person from each county, so you can have expertise from each county. We've got one more of these coming up on January 27th for juvenile justice. So we hope you'll join that one as well. And you can sign up on the website, which I'll share in a minute. Housekeeping, we're being recorded for this so that we can use these for training resources in the future. So hopefully you can stay muted throughout the training. We will do 30 minutes of presentation and then about 25 minutes of questions. Throughout the training, as questions pop up for you, put those in the chat, and then the trainers can either be scanning the chat and answering in real time, or they may choose to wait towards the end to just go through all of those, depending on sort of the flow of how it fits in with the training as it's going. So just wanted to share a little bit about System of Care. System of Care is a regional cross-system collaborative of youth, families, and system leaders who work collaboratively to improve the services and supports available to children, youth, and families in our region by building and funding a true system of care model in the Tri-County region. We support multiple meetings each month to address barriers and come up with some solutions. And we're trying to just ensure that all the services are well coordinated, culturally, linguistically responsive, youth and family driven, and community based. Just wanted to share real quickly about our website. There's the address there, systemofcare.net. You probably went there to register, but I wanted to share that there's some other training resources on there. The video of this will be put on there. There's a video for all 8 of the trainings that we've done up on the website, as well as some links and just different training resources on there that we hope that you'll take a look at and pass along, especially to new staff as they get hired, or just use it as a place to kind of pop back and learn as you go. You can also submit a system of care barrier if there's issues with access or cultural and linguistic responsiveness, etc. You can put a quick note in there about what you're seeing and what you think needs to change. So I'm going to pass it off to our presenters today, and appreciate everybody for joining us.
Thank you, Kirsten, for sharing the slides. So I'll introduce myself, we'll introduce ourselves as the presenters, and thank you all for joining us for an overview of intellectual and developmental disability services. My name is Beth McHugh. I'm the program manager for the Children and Young Adult team in Multnomah County.
Hi, I'm Ann Anand, and I'm an eligibility specialist in Clackamas County.
And I am Kirsten Oster, and I am an in-home services coordinator supervisor with Washington County. And we'll get into what in-home means throughout the presentation. All right, so I'm kind of going to start us off with describing who we are in each different county and how we work within the state system. So all counties operate under what is called the Office of Developmental Disabilities at Oregon's Department of Human Services, so ODDS. And within that, each county is described as a Community Developmental Disability Program, CDDP, or case management entity. And what our overall goal is as a state working under ODDS is to increase the overall quality of life, promote independence and integration into the community by providing resources, linkage, and in-home and community supports for the individuals that we serve. So with that, we're going to kind of do a quick overview of what developmental disability services look like at a county level. And we do like to point out that DD services all are voluntary, which means that the person and family have a choice whether or not they want to pursue the application process for eligibility or access the services that we can provide through the DD funding system. We work in tandem with many different systems and entities to help support the person. And that's how we work in collaboration. Again, it's the person or the child that we're supporting, accessing services, their natural supports, which are their parents, legal guardians. Sometimes that's the Department of Human Services as a legal guardian. We work with the school systems to try and support them. And once an individual gets older into the youth and teen years, to start accessing job supports through Voc Rehab. And then we also work with the additional therapists, psychiatrists, and other providers. So there is multiple members of a person's life that create the support system that we are a part of. So what we do and what we provide is, again, each person and family, they have the choice to access the services through the Developmental Disability System. And what we can do is we can assist with the coordinating of emergency interventions, such as if the person needs in-home support or attendant care. We also participate as a liaison between the school and the child and the family. We also work with different advocate agencies to help support the family in the school system as well. We guide and support the person and their family to plan for the future, so looking ahead. And we also assist in creating a transition plan that is meaningful for the person and family when moving through the different phases of life, through childhood, needs change into the teen years, which change into the adult years. So that is an overall view of what we provide as an overall, but we will get into more details what that all means further in the presentation. So with that, we do like to point out what is not included in the developmental disability system. Again, we do work in tandem with a lot of different systems to help support the family. And so what we can do is we can support the individuals with resources and support. However, like I said, we're only one of the puzzle pieces within the system. So we can help with direct financial benefits such as social supplemental security income or SNAP, but we do not provide that. That's through different services. We do not make determinations for Medicaid. And I just wanted to put what Medicaid is, because it is different from Medicare, and it will come up again in the presentation. But Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities, including developmental disabilities. So if a family with a child who's experiencing a developmental disability or intellectual disability and are not considered low income or 300% of the poverty line, the child can still access Medicaid services in order to get what we kind of refer to as a key. So Medicaid is the key to the door to start getting services. And also I wanted to note that Medicaid is administered by the states, and we work under the federal requirements, which is the Center for Medicaid, or CMS. And this program is funded jointly by states and also by the federal government. So that's my little introduction to Medicaid. We also do not fund specific therapies. We do work with OTs and PTs, so occupational therapists or physical therapists. And we also work with speech therapists, but we are not the funder of that source. Those benefits are accessed through insurance, whether it be in private pay, whether it be private insurance or insurance offered through OHB or Oregon Health. We also do not offer or provide protective services for children. That falls within the child welfare realm of Oregon. So services coordinators are mandatory abuse reporters, and if we do get any type of report, or if we see anything, we always report to the Department of Human Services Child Welfare. We also do not provide childcare. We help with attendant care and skill building, which we'll get into a little bit later. And we do not provide educational supports, but we do provide support within helping the person, especially with virtual services, which again, we'll get into with more details. And we also do not have any crisis services available. So what we do if someone needs immediate crisis placement is we try to find services that we can implement into the home before we look into any sort of residential placement outside of the home. So with that quick overview, Anne is going to get into the next piece.
Hi, so I'm going to talk a little bit about our eligibility criteria, because before anyone can receive services, they must be found eligible for the program. So the criteria for school-age children and adults is the same. There's another category of young child eligibility that's a little bit more simplified, and I'll review that as well. So a person can be eligible for DD services in two ways. One way is if they have an intellectual disability. This must be documented prior to age 18, so prior to adulthood. And we start with IQ scores when we're looking under this category. And I don't know how familiar you might be with IQ testing tools. Those assessments generate lots of different types of numbers. We look at something called the full scale IQ, or the FSIQ, and we can consider FSIQ scores up to 75. If that score is above 65, so between 66 and 75, we do require an additional assessment, something called an adaptive assessment, also a norm standardized assessment, just like the IQ testing is. And that is basically going to give a measure of a person's independent skills. It's going to give scoring that gives you an idea of what kind of support needs a person has across all areas. So the state of Oregon requires that that individual have significant impairment in their independent skills. And that must be primarily because of that intellectual disability and not to some other diagnosis. So not to a mental health diagnosis or some other medical condition. And the individual must also have an actual diagnosis of intellectual disability. So the other way that a person can be eligible for DD services is if they have a developmental disability. This is something that must be documented by age 22. And for the purposes of our eligibility, we define a developmental disability generally as a neurological condition that impacts the brain primarily and brain function. It is the state of Oregon that decides which specific diagnoses are qualifying. That's going to be conditions like autism, cerebral palsy, genetic conditions like Down syndrome, traumatic brain injury. There's actually a long list of qualifying conditions. Under this category, we are not looking at IQ scores, but we do require that adaptive assessment. And again, the person must show significant impairment in their adaptive skills, and that must be primarily because of that developmental disability condition. And then the state also says they must need support similar to someone that has an intellectual disability, and that again, it's just going to come down to scores on that adaptive assessment. And then there's another category that's a little bit more simplified, and this applies to children who are not yet 7 years of age and don't have certain types of standardized testing completed already. So we can use other types of early childhood assessments, and we can use information directly from that child's doctor, diagnosing a DD condition. And we look at 5 areas of functioning. If they're behind significantly in at least 2 out of those 5 areas, and that condition is expected to last indefinitely, then they may qualify for services under this category as well. So this is, in a nutshell, basic eligibility information. There are more details that we're looking at behind the scenes, but this kind of gives you a basic idea of what we're looking at. The other thing I'll say about eligibility is that prior to adulthood, eligibility is considered provisional, and that just means that we're going to review that eligibility again at least one more time before adulthood. Once a person meets the adult eligibility criteria, we do not typically review their eligibility again. Those conditions that are qualifying are considered to be permanent. And while, all of us with or without disabilities, we're lifelong learners, we're working on our goals and we're gaining skills. Once a person is meeting that adult eligibility criteria, it's assumed that that condition will always be impacting them to some degree. And so now I think we'll move on and talk a little bit about services.
Yes, so now we're going to get into the little deeper dive of what services are available. I'm going to be presenting on services that are available for children. And this is what happens after the eligibility process. So the person has been found eligible with the state of Oregon guidelines, and now we can look at what is available. So case management is required as a part of all DD services and to access what else we have through that. So this means that the individual is found eligible based on the state criteria and assigned a case manager or a services coordinator. And they are assigned to help with the navigation of finding resources, creating an annual support plan based on the person's needs. And then also this can be done through in-home. And by in-home supports, what we mean is the child and family live within their own home in the community and do not live in a foster care setting or a residential or group home setting. So that's when we say in-home, they are living in their own homes in the community. And most in-home supports are provided through what is called K-Plan, which I'll be getting into more details soon. Actually, it's the next slide. And what K-Plan does is the funding mechanism that opens the door to access a variety of in-home supports outside of case management. Currently, what we do have, you may be wondering, what does case management look like with COVID and the pandemic and working from home? So it has looked a lot differently. Case managers or services coordinators are used to going into the home, meeting with the family and the person face to face. However, we have been able to adapt to the needs and meet our families where they're at. So this could be with virtual platforms via Zoom, Teams, depending on what the family is able to access. Also still by email, by phone, and also the mail. Again, services coordinators have been trying to meet the needs of every person and family, even those who do not have access to technology or have challenges in issuing technology. So again, case management is still happening. We're still there supporting families, and our role as case managers or services coordinators has really expanded to our resources as well that we help families find during this time. So K-Plan, what is K-Plan? So like I said, K-Plan is the funding mechanism that a person can use to access different services. Again, the person has to be Medicaid eligible. And again, if the parent's income is above the income limit, the child can be found eligible for Medicaid based on their diagnosis of an intellectual or developmental disability. So once the child is eligible for DD services and the Medicaid is up in there, the services coordinators meet with the person and the family to gather more information on what is important to the person. So that's what goals do they have, or what support working toward goals would they like to see for the next year? And then also what is important for them. So that means, do they need additional support through different activities of daily living? So that is including, do they need help dressing? Do they need help tying their shoes? Do they need support showering? And also, do they need different supports with eating? It's also important within this to look at what the health and safety needs are the person or child are. And that can include what we refer to as risks. Again, it means what are the health and safety needs that family members, providers, people coming in to support the person need to know to keep that individual safe. So one example is that if a child is fiercely independent and likes to leave supervised areas very quickly, either through a window or through the door, that is noted on this plan to ensure that the person's safety is adhered to when someone is supporting them. The average timeline into getting all these services in place after the initial eligibility can be anywhere from 30 to 180 days. This is due to a lot of the different mechanisms that we have to do on the inside of the system to ensure that the person qualifies what we consider a level of care assessment through the Oregon Needs Assessment, and then also getting providers in place and also service agreements for the providers that will be either coming into the home. So more about the services is, I just wanted to highlight a few. There are a lot here, but some of the main ones that families access is assistive devices. So what this means is this could be adaptive eating equipment, specially designed clothing, durable medical equipment such as shower chairs, and repairs after insurance limits have been reached. So what does that really mean? What that means is K-Plan is the last payer of funds. So the first step that a family needs to do to access an assistive device is there needs to be a denial from the insurance provider, whether that be the private insurance or through OHP. Also, the state does require recommendations from specialists that provide the support, such as an occupational therapist or behavioral consultant if we're looking at purchasing sensory items. Another key service is the assistive technology. So this could be software for communication, reminders and alerts. It could also be a GPS system if, again, the person likes to leave unsupervised areas, and that is a concern. Environmental modifications, again, this could be ramps to make the home more accessible from the outside, grab bars within the bathroom. There are a lot of different things for environmental modifications, and it all is dependent upon the person and their needs in their current environment. This also pertains to vehicle modifications. So that's the adaptations for primary means of transportation to accommodate the need of the child or the individual and help them access the community. So that could be adding a wheelchair lift or any safety modifications. However, it can't be used to purchase a vehicle. It is only meant to enhance the vehicle that the person already has. And then we get into employment services. So employment services, the level of support and services available depend on the person's age, and it gradually grows. So the services coordinator works very closely with vocational rehabilitation to get the person the employment plan that fits them and what they see for their employment goals. I say attendant care for the last piece because it does involve a lot, and that's what a lot of people are looking for when they're accessing K-Plan is, I need some help. So what does that look like? So attendant care is based on the monthly number of available attendant care hours that are generated based on the supports that the family and person have identified in an assessment. It's called a needs assessment. So within that, the person gets the number of hours that someone can come into the home, in this case, to help support. And there are two types of workers. One is called a personal support worker. And what this means is there is more responsibility on the family because they are the employer of the personal support worker. So what that has meant is more consistency of who is working with the adult or child in the home. And then usually a timeline to have a personal support worker in place to help a person after the eligibility process is anywhere from 60 to 180 days. And again, that's just after initial eligibility. Another option for attendant care is provided through an agency. So the agencies are responsible for the employer duties that the family would be in charge for a personal support worker. Some things is that this could mean that different people are coming into the home to support the person. And then, yeah, the support that a person provides either as a direct support care worker or a personal support worker is these services exclude non-disability related services. So that means general child care, educational supports. So they're really there to support the person. And what has changed a little bit with the pandemic is it's really been up to the families who they decide to come into their home or not. Personal support workers and direct support professionals have been able to support children and individuals on a virtual platform as well. And they have been there to help with, let's say during the school time with this virtual learning, there's been a lot of changes, and someone who has a lot of challenging behaviors and having to focus, personal support worker can be there to support them, to redirect them and help them back to looking at the virtual screen. And then finally, the last service that I would like to highlight is relief care. So relief care is it's short-term care provided relief for the primary caregivers. So that means that that this service can be provided in the family home. Also, there is relief care provider homes or other settings that are certified by the state. And this service is provided in 24-hour blocks. So that is the more in-depth of a lot of the services that majority of individuals access when they are looking for K-Plan.
Thanks, Kirsten. So DD case management is available to people through their whole lifespan. And we tend to kind of break things up into children's case management and then high school transition time period and then adult case management. And a lot of things happen during the transition age for people. When you turn 18, like Anne had mentioned earlier, eligibility comes up again at either 18 or 21. So we need to pay attention to people's eligibility at those ages. When you turn 18, people apply for SSI and Medicaid. You no longer are looking at your parents' income at that time. So that's another important thing that we do in our system. Guardianship issues come up after 18. A person becomes their own guardian when they're 18. Sometimes parents pursue guardianship. It's not necessary. People are very capable of being their own guardian. Some people might have things in place like a healthcare rep or different things to help them with decision making. And then also at age 18, things start to change in your living arrangement. If you live at home and you've been receiving supports at age 18, your parent can become your paid support person. Parents can't be paid support workers for people under 18. Once you turn 18, a parent can be a paid support person for somebody. If you live in foster care or live in a group home, things also need to change at 18. If you live in a child group home, you have to move to an adult group home by the time you're 18. If you live in a child foster home, when you turn 18, the foster home either needs to become licensed as an adult home, or you need to move to an adult foster home, or it has to become licensed as an adult foster home. So age 18 is an important time in our world for DD services, and that's a time when transition case managers are very focused on helping the individual step in more to the adult world. And then one place that we wanted to kind of spend a little bit of time talking about was collaborating with child welfare. That the majority of children receiving services from DD live at home and their parents are their guardian, but there is a large number of children who have child welfare as their guardian and receive DD services. And a DD case manager never becomes their guardian. Child welfare always becomes their guardian. I think I see questions, and yeah, we'll do all the clarification stuff in a second. Thanks, Nancy. What was I saying? Oh, so collaborating with child welfare. Child welfare always stays the guardian, but DD can assist with different things in different living situations. One of the things that often happens is a child needs to be placed out of the home, and we work with child welfare on how best to find a placement. There are families that access voluntary placements into DD foster homes. In these cases, we can access a DD certified foster home, and child welfare isn't even involved. If a family just knows that they need additional support, they can access a foster home and stay the guardian. But there are many times when there's child welfare involvement, and DD and child welfare works together to explore placements and options that might best serve that child. Child welfare will often have a child in foster care that then becomes eligible for DD services. And in those cases, we don't make children move. The child stays in their child welfare certified foster home, and DD adds services into that child welfare home. And those can be all the services that Kirsten just talked about. So a child with a child welfare guardian who's in foster care, who becomes eligible for DD services, can access all the K-plan services that Kirsten was discussing. There are also DD certified foster homes, and they're foster parents who are specially trained to work with children experiencing a developmental disability. And there are times when child welfare will work together, and child welfare will say, is there any DD placement? Our certifiers work together across all the counties to see, is there a DD certified home? And that child can move into that DD certified home. And then we work together to put a DD service payment into that foster care placement. So that's also an option. And then there's another option, an even higher level of care. There are DD group homes throughout the state. And if a child can't be managed in a foster home, we can make referrals to DD group homes. And just like so many of the other systems, there are very long wait lists for the DD group home system, and there's not a lot of movement at times, but we are always collaborating with child welfare, with our other county partners to see what options are available for children needing out-of-home placement.
Okay, so how can a person or a family get this process started to access services? So the DD program is a statewide program, but individual counties administer DD services. So you must apply in the county where the adult or their legal guardian resides. So you must complete an application and submit that. And then we need to collect the person's developmental history and all that information to be able to show the state whether or not that child or adult meets the eligibility criteria. So either the family needs to give us all of that documentation, or they need to sign releases of information giving us permission to go get that information. And that is typically what happens. There is a citizenship standard that needs to be met. So that is documentation that's required. And then the timeline. So we try to make eligibility determination decisions by 90 days, but sometimes it does take longer than that. So people need to be prepared for that a little bit lengthy time in getting through this process. And I know a lot of folks are referred to us maybe in kind of a crisis situation. We do the best we can to work with community partners to help address those immediate crisis needs. But DD services cannot start until eligibility has been determined. And so I think the slide following will have contact information for the Tri-County area, and then I think we're including all county DD services contact information as well.
Well, that completes the more formal part of our presentation. I will stop screen sharing.
I saw some questions and chats come up, but then I kind of lost them as we kept talking. Do you want to read those, Brian, or should we read those?
Sure, I'd be glad to. Let's see here. What services are still available to families who don't meet the income level of Medicaid? Can they still have paid PSW through the K plan?
I'll take that, Kirsten. You want me to? So you have to access Medicaid. K plan is a Medicaid service. So if you don't have Medicaid, those doors don't open. But if a family makes too much money to get in directly based on family income for Medicaid, you can do what's called presumptive Medicaid eligibility. And I'm sure you guys have all been learning more about the One portal and the new way to access Medicaid for all. So families do need to go in through the One portal, be found not eligible for Magi, CHIP, all different kinds of Medicaid. And if they've answered the question saying their child has a disability and needs ongoing supports, it can be moved over to the presumptive Medicaid team for decisions in that avenue. So if your income is too high, but you have a disability, you can still go through the presumptive process, but you have to somehow get to Medicaid to access attendant care and all the other K plan services Kirsten was talking about.
Awesome, thank you. The next one we've got here is someone making a clarifying statement. Children can stay in DD child foster homes when they turn 18 with an approval variance, as long as they're still participating in school transition services.
True. Thank you, Nancy. Yep. If you're in school, because children with IDD can stay in school until 21. You can access transition services until 21 through the school. So you can live in a child certified home with a variance while you're in school until 21. At that time, your home would either need to become adult licensed or you'd have to move to an adult licensed home.
Next one, is there a significant wait time during COVID for services to begin once someone becomes eligible?
I can take this one. We haven't noticed any change in the wait time before COVID or now during COVID of how the length of time. It's still the same. We are still able to get all of the information needed to keep the personal support workers completing services, the assessments that need to be done, and also all the service agreements that be signed. ODDS and Center for Medicaid have made a lot of different variances right now during this time of emergency that we are able to work around in order to keep services going and keep the wait time as what they were before COVID. Anne or Beth, do you have anything else to add?
I would think.
Oh, sorry, Beth, go ahead.
I was going to say, would you guys agree with this though, that even though we can get people eligible, I think people are having a harder time finding caregivers during COVID. And I think it's hard for families to one, be willing to have people come in their home, and for care providers to be willing to come into people's homes. So I think that's definitely been a hardship, just the capacity
Definitely.
of caregivers.
I would agree with that. The other thing I was going to say is that once someone's been found eligible, everybody receives case management. So you will have a case manager assigned to you immediately that can help kind of problem solve through these types of issues. So even though, services may not be available right away because you're going through that assessment process or other types of things, finding a caregiver, you will have a case manager that you can kind of problem solve with.
Great. The next one's about citizenship. Citizenship standard, as in they need to be US citizens to be eligible. So.
I'll try to address this one. So citizenship standard, which also means that certain types of permanent residency will qualify. I actually pulled up the rule here on that, and there is a lot of detailed information about what will be accepted and what won't be accepted. So, certainly if you're working with a family, an adult or a child in a family, and it's unclear, they don't have citizenship, but maybe they have some legal residency, green card status, parents here on a work visa, those types of situations, we would just address individually and really work with that person to kind of get the information we need and work with the state to determine whether or not they can access services. So I hope that answered that question.
Oh, you're muted, Brian.
Muted.
One other thing on that, Multnomah is doing a small pilot project with offering case management to people who are not citizens. So Multnomah is taking part in a small pilot project that we could talk about in some other avenue if you had questions, but the vast majority is exactly what Anne said.
And I guess I can add, complicating that, often it's a situation where a family wants to apply for their child. The child is a citizen, they were born in this country, but maybe the parents are not citizens or undocumented. And again, those are tricky things that we try to problem solve and work with families in those specific situations. But certainly a family can apply for their child, and that child could receive services potentially, even if the parents are not citizens.
Okay. Let's see, next one is, why are some people reevaluated at 18 years and some at 21 years?
Oh, that's a good question. And I don't have a good explanation for that. I'm not sure what the rationale is to say that those with intellectual disabilities, we must review and determine adult eligibility by 18, and for individuals with a developmental disability diagnosis, we must complete that process by age 22. I'm not sure all the reasoning for that, but that is the state rule.
Okay, and next is, are BIPOC families able to receive culturally specific services? Spanish speaking, for example?
I'll jump into that. I think each county has things set up differently. And Multnomah, we have case managers, we call them KSAs. What's the KSA stand for? Knowledge, Services, Abilities? I'm not sure. But we have KSA case management positions for Spanish, Vietnamese, Russian, African American, and Chinese in our children's team of case managers. And we really do try to assign for specialization based on a family's needs. We can't guarantee that everybody with that need, we do oftentimes rely on interpreter services. Not every case manager might be able to speak the family's language, but it is a definite priority that we're striving for more and more.
I can speak a little bit to Washington County. So for our in-home team, we have Spanish-speaking services coordinators that help support Spanish-speaking families. And we also try to let our providers know, so agencies that provide direct support professionals, that there is a need for Spanish-speaking attendant care that's needed to meet the culturally specific needs. We also have access to translation services when we're unable to meet that language need. So we try to meet the family the best that we can with the resources that we have available, specifically with their language needs. And we're also, we work closely with ODDS. They release all their correspondences in, oh, Beth and Ann, I don't know how many languages is each notification to families released in?
I'm not sure. I've seen the list, but I don't know all of them.
All right. Next one is back to the variance to stay in a child foster home until 21 if still participating in transition services. Is this new as a result of the pandemic, or has this been true for some time?
This has been true for some time. If you have a variance, you can stay in your child certified foster home. And Nancy, I saw you were on here. Do you want to unmute and maybe talk a little bit more to that piece? Is that putting you on the spot?
No, that's okay.
Hi, Nancy.
Hi. No, that's been the case, but the key point is approved variance. So to get a variance for a child who turns 18 to stay in a home, there has to be a team meeting and a safety assessment completed to look at whether that individual, if it's safe for that individual to stay in that home, if there's other children in the home. So not every child who turns 18 gets approved for a variance, because in some circumstances it's not safe for them to be around other children under the age of 18. So the key point is the approved variance piece, but they do need to continue to participate in transition services. If they choose not to participate, drop out, then the variance would be rescinded.
Great. All right. And we're at the end of our questions. If there are any final questions, feel free to ask those now. And if any of the presenters have anything else they want to, oh, we got one here. What is the age limit for these services? Do they transition to another program once clients become over?
There's no age limit. DD services through the county go all the way until you're elderly. You know, as people are aging more and more, we have more case managers specializing in elderly people with developmental disabilities. People are living a lot longer. So it is the whole lifespan for county DD services.
Great. All right. Well, we might be, oh, they keep coming. Great. Is there any supports for those who weren't able to be diagnosed before 18 or 20?
I can just address a little bit that issue of being diagnosed before 18 or 21. So it isn't that the diagnosis itself has to be there, but there needs to be documentation by a qualified medical professional that in their judgment that intellectual disability or the autism diagnosis or other DD qualifying condition was present prior to age 18 or 21. So in some instances where you have maybe a family that's been supporting their child who's had an intellectual disability, they've kept them at home, they've done everything they can to provide supports, and maybe those parents are aging, they're elderly themselves and need supports, and they can no longer care for their adult child in their home, but that person has very little testing, there's not much documentation. In those situations, we can sometimes, you'll have an assessment completed by a psychologist who can document for us that, that intellectual disability certainly went back to prior to adulthood, and we may still be able to find that person eligible. So there's a little bit of sleuthing that we can do to get the information that the state requires, short of an actual diagnosis that we can find in that history. So hopefully that answered that question.
Thank you. And the person said thank you. So I guess they got it answered. Well done. Thanks, everybody. I think we're maybe at a place to wrap it up here. I really appreciate the three of you coming to present and working so hard on the materials to get this thing going. This has been a long project. We started on it last year and a lot of work was put in, so I really appreciate everybody. And yeah, I guess just thanks everybody for joining us today.
Thank you very much.
Thank you all for showing up.
Yeah, thanks everybody.
Thank you. Thank you.
Thank you.
Thank you.